Hi everyone, thanks for logging on to the webinar today. This is Collaboratively Creating Goals of Care with our patients. So my name is Sandra Anderchuk and I am the Clinical and Organizational Ethicist at Hamilton Health Sciences. During the next 20 to 30 minutes, you'll learn about the importance of care planning with our patients. We will describe the benefits of value-based conversations and how these discussions can help healthcare professionals and teams have a deeper understanding of our patients and their health preferences. This shared understanding ultimately leads to care plans that align with patients' wishes and are based on reasonable recommendations of available options by our health professionals. Three key aspects will be discussed. We're going to talk about advanced care planning, serious illness goals of care, and treatment decisions. It is important to consider, first of all, how treatment decisions align with patients' wishes, values, and beliefs of their care. In Ontario, advanced care planning, goals of care, and treatment decisions and informed consent are all situated along a person-centered decision-making continuum, which is pictured in the diagram that you see on your screen. A person's health preferences may change over time, so it's important that we continue to revisit the goals of care for our patients. It is also important to ask patients about previous discussions that they've had with their health professionals and their loved ones. These discussions can often be used as a good starting point for further discussions with our patients. When a patient has a serious illness or a life-limiting illness, it's important for them to be prompted to think about their wishes, values, and beliefs and how these may evolve into their health preferences for care now and in the future. Having conversations with the patient that focuses on their health preferences will help providers work with patients and their loved ones to understand what their wishes are and how this can equate to future goals of care. I'm going to hand it over now to my colleagues, Dr. Packard and Dr. Youssef, to provide more in-depth detail about advanced care planning, goals of care, and treatment decisions.
Hi everyone, my name is Dr. Tamar Packer and I'm a community family doctor in Hamilton as well as the Chief of Family Medicine at HHS. Thanks for inviting us as family doctors to play a part in this educational presentation. Advanced care planning is something that is incredibly meaningful and impactful, and I see it as part of a logical journey that prepares those we care for and their family members so that they can be presented with options and understand a goals of care conversation at a later date. This is very much a process that evolves over time, and as Sandy alluded to, it's really centered on values, wishes, and beliefs. And one of the benefits in primary care is that we tend to have a longitudinal relationship with the folks we care for, so that we have an intrinsic understanding as to their values, wishes, and beliefs. And this actually makes us a natural place to begin these conversations. One of the most important things that we have to remember is the relevance of the SDM, or substitute decision maker. Because although we may be initiating, or perhaps the patient initiates with us, a series of meaningful conversations over time that enable that person to understand where their values and wishes will take them, sometimes it's overlooked to have those same conversations with the people in their family or in their circle that ultimately may be designated as their SDM. And the relevance of the SDM, or substitute decision maker, is that in the context of lack of capacity of the individual, the SDM will be looked to assist with this decision-making process. So on the slide, you can see there are certain key points that relate to determination of an SDM that one needs to take into consideration. And capacity is a really important issue in terms of the capacity of the individual that's at the center of the care we're supporting. And the capacity actually relates to capacity of the individual to understand the situation at hand. And the situation at hand is that of advanced care planning. So do they understand in a very concrete sense the immensity of the illness that they're facing, perhaps the timeline that they're confronting, the context and the consequences of the choices they might make around their care and goals of care? Similarly, the substitute decision maker must meet the test for capacity, and that test is not a legal construct or a very defined screening process. It's the capability to understand the complexities of the decisions around care of the individual. The SDM is a legal role. It's governed by the Healthcare Consent Act, and a common misconception is that the SDM is actually the same person that would make decisions after the individual passes on. And that's actually not the case. The SDM's role endures up until the time of death, and would relate to decisions around personal care, but it's the executor of an estate who's asked to provide and weigh in on behalf of the individual after the time of death. So I wanted to draw your awareness to an organization called Speak Up Ontario. Speak Up Ontario, I think, is probably recognized by many of you watching this webinar. It's an incredibly helpful organization that have developed resources for individuals and families, for healthcare providers, and for non-healthcare professionals. You'll see on the slides that there are links to many of the toolkits that Speak Up Ontario has crafted. We use them personally. One of the things that I particularly like are the conversation aids, because they enable you as a care provider to find the right words. And I think for some of us who've done this for a long time, it feels natural. But I can assure you that the first few times that you embark on this journey of having these meaningful and powerful conversations, sometimes you fumble for finding the right words. And the Speak Up resources actually give you the trigger lines that you can use, and eventually you'll notice that they just become part of your jargon and feel more natural. And one of the things that we've done with the community for family medicine is we've taken these speaking guides and built them into our EMRs, our electronic medical records, and created templates where we can compose our notes as we're speaking with patients and actually record in one form the conversation as well as the outcome of the conversation. Another one of the aids that's really helpful is this SDM hierarchy, because I think we all sometimes fumble with remembering exactly the different gradations, all the way from a very close family member to somebody who's appointed at a governmental level. The resources are written at many different levels of literacy, and there is really something there for everybody. And the decision-making alignment, I think you'll find very helpful as clinicians, but the patient resources can really help prepare as well. So please check out those links. What are advanced care planning conversations? Well, to me, advanced care planning conversations are particularly meaningful, poignant, and a phenomenal opportunity to really understand and reflect on the individual that you're sitting with. It gives you an innate understanding of how they see life and the experiences that have helped shape them to the person that they've become, so that they can then derive comfort in making decisions that are often very trying about their health. One of the things that we are changing in our approach is we used to sort of relegate advanced care planning to, oh, well, somebody is approaching that end of life stage, and my goodness, if I haven't conquered this, I better approach it now. And I think we've all read the evidence and are quite aware that advanced care planning is something that has relevance to anyone at any age, for the simple reason that we never know what's coming down the path. And it helps us to sort of chip away at that conversation and enable people to begin to reflect and think about what makes them tick and what gives them greatest meaning in life. So there's no wrong time to start this conversation. It's really also about knowing who would guide them in the event, as I said, that they would no longer be in a position of being able to make a decision. And it also is a reflection, and it helps to work them through the process of looking back on decisions that they may have made in the past, so that they can better understand what has guided them. Because sometimes people will have made a decision in the past and not quite understood how they got to that place. And by working through that with them, you can help them tease out what was running in the background. The information that is shared by a patient can be of great value to their SDMs in the future, particularly, as I said, if they become unable to make the decision on their own. So two of the most important outcomes of advanced care planning conversations are knowing who the SDM will be and confirming that that person is available and acceptable, and ensuring that the patient, who's at the epicenter of all of this, has well communicated their wishes with their SDM. And what are some of the benefits of advanced care planning? I think the biggest benefit that I see is not only for the individual, but for their close family members and friends. Because when their final days are near, people have far more comfort and are able to share their quality time and have frank conversations without feeling like they're walking on eggshells and wondering what has and hasn't been discussed and what has and hasn't been thought about. And there's a clarity that comes with that that is really peaceful in that those close can simply make the best of the time they have together, as opposed to trying to persevere and work through some very complex and tough and emotional issues. It's very empowering to the individual because they've been given the opportunity to shape their own destiny, and that gives them some comfort as they walk down a path that can be both emotionally and physically quite devastating. And as I said, it gives tremendous comfort to their loved ones, because it can be very awkward to be the partner or the loved one of somebody who's suffering when those conversations haven't happened and you're really not quite sure what they would have wanted, but you're long past the point of being able to have that meaningful conversation. And I think where this leads is shaping future conversations for those who've gone through advanced care planning and being able to transition over into goals of care. So how are advanced care planning conversations related to future care? I think I've covered a fair bit of this material, but the high points that I would probably reflect on, Sandy started the webinar by focusing on advanced care planning as an exploration with the individual patient of their values, wishes, and beliefs. And I think that when advanced care planning has been done in an iterative way, those values, wishes, and beliefs have been explored with sufficient depth that when an individual transitions into a hospital environment with a fair amount of medical complexity and diverse options and contingencies to care, they're much better set up and enabled to understand the goals of care's discussion that will ensue. So at this point, I think I'm going to transition over to Haroon.
Hi, everyone. My name is Haroon Yusuf. I'm an internal medicine doctor over at the Hamilton General, and I'll be talking to you about having serious illness conversations, and the focus will be more on the actual practice of this and how to do it effectively. So basically, what is a serious illness conversation? Dr. Packer has mentioned a lot of these things already, but it's essentially a conversation when you ask patients about their values and their goals. You share a prognosis when it's appropriate, when the patient has given you permission to do that. And the focus is more on the patient's values. And so you're not emphasizing treatments, specific treatments or procedures, rather focusing on values. And you try to do this early so that it provides a foundation for decision-making as you move forward through the illness process. Okay, and it's something that can be revised over time. It's important to go over what a serious conversation is not. So it's not, like I mentioned before, solely focused on medical decisions. And it's not necessarily a conversation that's focused only on code status and discussing whether a patient is allowed natural death or for intubation. Rather, it's the conversation that informs that decision-making and gets at the patient's values. So it's more of a place where you frame the patient's values and you get them talking about what's important to them. And then that can later on inform the actual care that's going to happen. Dr. Packer has mentioned a lot of these things already, that early conversations help with goal concordant care. Some of the things that that have been shown in studies that it's been shown to improve is that it improves patient satisfaction at the end of life. It eases decision-making burden on families because they're better aware of their loved ones' values, and they're making decisions more in concordance with what they would want. And it allows for earlier intervention of hospice care, and leads to fewer hospitalizations and improved bereavement outcomes. So these are some of the benefits that we can have by doing these conversations both early and also doing them effectively. When I first I first heard about the Serious Illness Care Program and the way that it provided a scripted guide to having serious illness conversations, I was quite skeptical. I thought that the idea of using a script or using certain patient-tested language would make me sound robotic and maybe not be as genuine in having these discussions. But after using it, I've found that it can be quite effective, and the patients have actually come up to me and just thanked me for having these type of conversations. So I've actually noticed an improvement, at least anecdotally, in terms of patient satisfaction when I use the type of language that's been patient tested. In addition, it makes sure that important points aren't missed, so it allows for a more comprehensive conversation, and it also gives you strategies on how to deal with strong emotions that may that may come out when you're having these difficult conversations with patients. So some of the benefits of having goals of care conversation for patients is that it provides open communication to allow them to explore their worries and some of their fears, and then how this will affect their standard of care. In addition, it's critically important that patients identify substitute decision makers, and prompting these conversations prompts them to furthermore find these, identify these substitute decision makers. And that can make the illness process as things progress that much easier for them and their families. We've already talked about how it helps to align it helps to align the patient care plan with their values. But in addition, we've found that, especially at the end of life, it really helps with reducing patient anxiety, distress, and feeling of isolation. Finally, the other big thing that other big benefit of having these goals of care discussions effectively and early is that it decreases the utilization of unwanted interventions. So for instance, patients may not want, once you actually have a discussion where you bring about their values and some of the trade-offs patients are willing to have, they may not actually want to have CPR or aggressive ICU measures performed on themselves. So it helps to reduce that burden as well. So over at Hamilton Health Sciences, we've been using the Serious Illness Conversation program, and this includes a Serious Illness Conversation guide. And what this, so there are two parts to this. The first is that we give the patient a pamphlet that's the patient-facing material that advises them to prepare for having a goals of care conversation. And we find this useful because the patient is able to think about things that are important to them, the values that are important to them, and also it helps with the patient in getting into the mindset to discuss this. In addition, it advises the patient to bring along their substitute decision maker to help with this process, and other family members that are important to the process can be involved as well. Some of these, currently we may not be able to have these conversations in person, but also if we're able to prepare the patient, it can allow for us to have these conversations with the SDM virtually if they're not able to meet with us in person. So in terms of having these goals of care conversations, we have 6 steps that we believe allow it to happen effectively. The first is a setup. So that's where you introduce the idea that you're going to be having this conversation, and you ask patients for their permission. And this is important because you want to ensure the patient's in the right frame of mind to have this difficult conversation. The next is assessing the illness understanding. And this is basically where you ask them if they how well they understand their medical condition and how they would want their information shared with them, right? Some people would want very comprehensive sharing of all the information, and some people like overall big picture, right? After that, in addition, you get their permission to share the prognosis. Once you've gotten their permission, you're sharing the prognosis. Try to make sure you tailor to the way they would like. So if they want the overall big picture, try to give them a big picture. If they want fine details, share that with them. At this point, there may be some strong emotions that the patient expresses and the family expresses. In a later slide, we'll be going over how to deal with strong emotions. After that, you want to explore key topics that are important to them, right? You want to ask them about what their goals are, particularly in a setting where their life may be limited by illness. What are their goals? You want to ask them about their fears and worries, particularly when it comes to their illness and as the illness progresses. You want to ask them about their sources of strength, what gives them hope. You then want to ask them about critical abilities. And these are those abilities that are so important to them that they can't imagine living without, right? So for some people, it could be their independence, their ability to ambulate, their ability to stay at home, right? You want to really get a sense of what those are. You then want to ask them about trade-offs. So what are the things that they're willing to trade off for a little bit more time, right? How much quality of life are they willing to sacrifice for treatments that may give them a few more months, right? That's important to ask. And then finally, you need to talk about family. So who do they include their family circle, and how do they want this information shared with them, right? Ideally, you'd want the substitute decision maker in the room with you, but sometimes it doesn't happen. And sometimes, especially in a setting where visitors are limited, you may have to do this virtually, right? So you want to strategize with them as to how you're going to be sharing this information. The next step is closing the conversation, and that's where you summarize what you've heard. And again, you're focusing on summarizing the main important things are the prognosis and the important values that they mentioned to you, their goals, their fears, their critical abilities, those values. And that allows you to make a recommendation. Oftentimes we're hesitant to make a recommendation around goals of care and treatment, but once you've had a conversation based on the patient's values, you can frame it in a way that you're saying, based on the values that you have said to me, that you said these critical things are important to you, my recommendation is, for instance, that we do not pursue some of the aggressive treatments that are going to limit your abilities to do these X, Y, and Z critical abilities that are important to you, right? And that's an important step to make. It may be a departure from what you're used to, but it's important to make this because it almost gives the patient the permission to take that step. And again, it's not a recommendation based on the best medical evidence necessarily, but it's a recommendation based on their values. After that, you affirm your commitment to the patient about how you're going to be there through their illness journey and support them through it. And the final step is documenting that conversation. Just some tips for the conversation. As you mentioned before, it's useful to familiarize yourself with the guide, and you can find it on our links to it, both online and on our ethics hub within HHS. Try your best to stick to the language of the guide. As I mentioned before, this is patient-tested language. It's been shown to be effective with patients, so try to use it as much as possible. If you're working with an SDM and they're not able to come in to physically be there, try to use video as much as possible instead of the phone, because there are a lot of body language cues that you can get over on video that will not translate over phone. It's also important that if you are using video, that you make sure you're in a place where there's not a lot of background movement and background noise. and that when you're talking to the patient, you're doing your best to stare into the camera as opposed to staring at your screen, right? You want to be able to try to make as much of a connection as possible, okay? If you're working with interpreters, make sure that you have a discussion with the interpreter beforehand, and discuss some potential challenges and questions that may come up, so that the conversation goes as smoothly as possible. Use silence and do your best to acknowledge emotions when they arise. It's much trickier to use silence in video conference, and that's why it's so important that you be in a place that's quiet, and that you try to make that eye contact with your camera, right? So even if there's silence in the video conversation, you're still maintaining that degree of connection with them. It's also an important reminder here that, you know, these conversations are difficult, and if you find yourself struggling with these conversations, reach out for help. Try to debrief with your colleagues for support, self-care, and you know, so that you have that strength to continue on with having these important discussions, okay? And it's important that you create that circle of care. So as I mentioned earlier, goals of care conversations can often bring out strong emotions for patients and family members, and a helpful mnemonic that can be used in terms of reminding you of tactics to deal with these difficult emotions is the mnemonic nurse. The N, the naming of the emotion. This is a step that I think it's important to you to decide whether you want to use it or not. I find that in patients who are in relationships where you know the patient well, this may work well, but oftentimes if this is your first time meeting the patient, you may not be able to know how they'll react to you naming their emotion. But this is a step that if you're an experienced clinician who knows a patient well, it can work quite effectively. After that, you use understanding statements, such as, I can't imagine how this feels for you. The R is respecting their nonverbal response, respecting them using nonverbal response. This can be as simple as silence. If it's possible for you, you can use physical touch. But again, you want to gauge if the patient is okay with that. Okay. Then move on to supporting statements, such as saying statements such as, I will support you through this illness, and maybe giving them some specifics of how you're going to support them. And also using exploring statements, such as, tell me a little bit more about why you feel like this, right? If they use specific emotions to describe what they're feeling, ask them to tell you more and really get into the nitty-gritty of their fears and their worries. And so you can see the serious illness conversation, it's a general conversation about goals of care and about patient values. And we find that it really helps to enhance both treatment decisions and informed consent about end-of-life care decisions, because you're really getting to risks, benefits, and values, and that really will help them make an informed decision, and that both the patient and the care team can feel comfortable about pursuing.
So to summarize, the goals of care discussion ensure a person living with a critical, chronic, or life-limiting illness understands the serious nature of their illness, while helping health professionals understand the patient's values and goals that they have for their care. These discussions often focus on the current clinical context and ensure the individual is better supported throughout their care journey, which is ultimately important. Goals of care can provide the basis for treatment decisions and informed consent, and a creation of a plan of care that feels right for the patient and is supported by the healthcare team. So we've talked a lot about a number of resources today. There's conversation aids, there's scripting aids, both for clinicians and for patients and families. And so I just want to point you in the direction of the HHS Hub. We have our ethics site that has a tab listed as goals of care. And in that tab, if you click on that tab, it will lead you to a number of different resources that we have available. You can also find these resources on the palliative care website as well on the Hub. So there's lots of information that's out there for you to access and to help with some of these difficult discussions. And ultimately, we want to collaboratively create goals of care with our patients and their substitute decision makers. So thank you very much for logging on today, and have a wonderful day.